Hello, Mr. Evans.
Hello.
Hi, I'm Dr. MacDonald.
Hello.
Nice to meet you.
Hi.
So I understand you had your endoscopy last week,
Yeah.
and I don't know if they told you at the time, they took some biopsies from your duodenum, a part just beyond your stomach.
Right, okay.
And the information I've been given is that you've come back to clinic for the results
Yeah,
for
yeah,
that.
yeah.
So we did another test in clinic as well, which was a blood test
Okay.
and this biopsy test. And what they've both shown is that you have a condition called celiac disease. Have you heard of celiac disease before?
It's sort of familiar.
So celiac disease basically is an allergy to gluten or products that contain
Right.
gluten. And your gut is obviously exposed to all sorts of substances every day. Whatever you eat goes through your gut. And sometimes the immune system misrecognises things as invading or threatening organisms when in fact they're just a component of your normal diet. And that's essentially what happens in celiac disease. Your body mounts an inflammation response. So things get very sore and red and angry in response to just gluten rather than a bug or something like that.
Right.
Does that make sense?
So that's what's been causing, so the gluten's been causing the pain and the swelling and...
Exactly, and the symptoms you've been having.
Right, I see. Well, you know, what you're saying isn't actually news, and
Right.
I predicted this, and I told my GP this, because this has been going on for about a year.
Yes.
Right? And I went to him and said I've been having abdominal pain and swelling, and he fobbed me off a few times, and then he gave me some drugs, some antacids or whatever they're called, okay? And they didn't have any help. And I went back to him quite a few times over the year, and I said, I'm sure this is to do with my diet, and it's to do with wheat, gluten.
Yeah.
And it was only till I had started losing weight, and I got worried about that, then he referred me to you.
Right.
So I could have been here. I mean, I've been eating stuff that could have well damaged me, and he has not diagnosed it properly. I could have had this diagnosis about 6 months ago, and now I've been having pain and been probably damaging myself because this idiot didn't refer me to you in time.
Okay, well, first of all, let me explain that celiac disease is reversible. So you may always have the allergy to wheat, but by stopping the gluten in your diet, we can reverse the inflammation in your gut. So we should be able to get you feeling a lot better very soon. That's the first important thing to say.
Good.
In terms of having done yourself damage, there is a danger that for some time you've not been absorbing all the nutrients you need because your gut's not working properly. So sometimes you can not absorb calcium and iron and other substances.
Oh, great. So
now, there's no evidence of that on our test, but we can do tests for that, so we can check your bone density is okay and so on and so forth. And once again, once we stop the gluten, your gut will start working again, and you can start absorbing those things again properly. And
we're saying it's going to be all right. I mean,
absolutely.
if we get okay, fine.
And I think that amount of time lost, I mean, you may have had celiac disease for a lot longer. I mean, it sounds like from the information we're giving, you've had non-specific pains in your tummy for some time.
Yeah.
And I think that what lots of people report once they've started excluding gluten is they feel great. They didn't even realise they could feel that well. So there's lots of reasons to be hopeful that just in a few weeks' time from now, we can get you feeling a lot better. Cool. And hopefully when we will have to have a look down again and take biopsies again, I'm afraid.
Oh, God. All right.
Just to make sure things that you've responded to the gluten-free diet. But we can be quite confident that there'll be an improvement. It's unusual not to see one. So the first important thing that you should know is that this is treatable. Most people respond very well to the treatment, which is exclusion of gluten from your diet. And that there shouldn't have been, at your age and with the story of how long things have been going for, long-term damage in terms of not absorbing the right nutrients. And even if you are deficient in various nutrients, we can correct those. We can give them to you. Okay. So
and we can sort that out. So you'll be able to find out what I'm, how I haven't been absorbing and all the rest of it. So we can get my diet sorted out.
We'll make sure we've done we'll check to make sure we've done these tests already, and any we haven't done we'll do as well.
Okay.
The next person you'll meet after me is a dietitian. Because they'll explain to you not only how you can correct any of those deficiencies, but also the ins and outs of avoiding gluten in your diet, which are complicated.
Okay. And what about damage, long-term damage? Have I at risk of anything like that? Because I've been with the gluten.
I think it's unlikely given the duration of your symptoms, but You may have not been absorbing enough calcium, for example, in the past, and that might have had an effect on your bone density. But as I said, these are correctable things to some degree, so we can give you more supplements. And once we've sorted out the problem, when we can make sure your gut's working, we can stop that from happening again in the future.
Okay, cool.
So it's not as though we've done lasting damage by not diagnosing this sooner. So.
But all the same, it should have been, not by you, but it should have been diagnosed by my GP sooner.
Right.
I mean, he should have referred me earlier too. Don't you think he should have done that?
Well, I think that lots of patients we see have had symptoms for a long time before they've come to our attention. And I think part of the problem is that the abdominal pain is a very common symptom, and lots of people who visit their GP have abdominal pain, and probably at least 1 in 10 of them. And there are, because of that, very well-described lines of investigation, which most GPs, it sounds like your GP has followed, so he's tried an antacid first. That's not worked. And as soon as you developed what we call an alarm symptom, so weight loss, he's referred you on for endoscopy. So that sounds appropriate. But these things do sometimes take time to diagnose, and it's very difficult for me to comment.
It's a long time to diagnose it.
Sure. I mean, it's very hard to comment because I don't know what went on between your GP and you and what was in the notes and discussed and so on. But
I mean, would you, if I find out that actually he could have referred to me earlier, or we decide that he could, would you provide some evidence? Would you provide a letter for me so I could make a complaint?
So I can't do that, and the reason I can't do that is that it's impossible for me to say whether or not your GP missed something that meant he should have been referred, because I have no idea what went on in your consultations between you, and it's not really my role. I mean, my role is really to make sure we sort out your problem, which we can do. And to make sure that we check in the future to make sure it's not coming back, and keep a close eye on you from now on in. Okay? I don't anticipate any problems with that. I think I'm hoping we'll have a very good response to excluding gluten. Now we know what the problem is.
Okay.
So I know this is the good news in a way, if you like. I know I've told you you've got probably what will be a lifelong allergy to wheat, but the good news is that by avoiding gluten-containing products, you can feel a lot better, and we can reverse the problem in your gut inflammation.
That is good. That is good.
And so where you'll go from here is we'll have a consultation with a dietitian now. Avoiding wheat is not or wheat-containing products or gluten-containing products. It's everywhere. There are lots of foods that don't necessarily declare that they have gluten in, or they do, and they change from month to month or year to year in their formulation and ingredients. We'll put you in touch with the Coeliac Disease Society, who have a website where they regularly update the foods. And increasingly, foods are becoming more available which are gluten-free in all sorts of things that normally required wheat, that because of advances in food technology don't. So having celiac disease now rather than 10 years ago is a much more tolerable condition. You can often find food substitutes for things which are very palatable. And I can give you the website address, and they also produce a book every year with gluten-free products, which is very useful.
Great.
The dietitian is also very keen. In fact, from follow-up from here will probably be with the dietitian primarily, but also, as I said, you'll come back and we'll do an endoscopy in about 6 weeks' time to make sure things are healing up as well. So very important we make sure things are getting better, otherwise we can't really guarantee that you're absorbing all your nutrients.
Yeah, no, sure, no, we'll go ahead with that.
And obviously keep an eye on your weight and so on and so forth as well. So I understand that you're upset about your GP not, or apparently
it's been
not.
Uncomfortable for a long time, you know, and I just wanted it sorted out sooner rather than later.
I think, as I said before, lots of people, once they start excluding gluten completely, within a couple of weeks feel better than they've ever felt before. Didn't realise they could feel that good and have so much energy. So what I suggest is we start the diet right away. See how you feel in 2 weeks. And then
so I'll check in with you in a couple of weeks' time.
Exactly. So you'll have an appointment now with a dietitian, and again in 2 weeks' time, see how you're getting on, and then we'll repeat the endoscopy in the future. Does that sound like a reasonable course of action?
Sounds like a plan, yeah, fine.
All right.
Okay, thank you.
Okay. So this scenario is asking two things of the candidate, really. One is to explain a diagnosis and its repercussions and its management. And the other is to deal with a complaint or a potential complaint. It becomes evident quite early on in the consultation that the patient's unhappy that there's been a delay in diagnosis, perhaps inappropriately unhappy, since often there's a delay in diagnosing conditions which have such non-specific symptoms. I think the key thing is to make sure that you explain the benign nature of the diagnosis as long as it's treated appropriately, and also that he can expect to feel well and take the edge off the anxiety that comes with any any diagnosis of this type. And there are lots of reasons to give a very positive outlook on the outcome in celiac disease. There's an argument that some examiners might expect you to go into more detail about, for example, what you might do if someone doesn't respond to gluten exclusion, or indeed what the long-term complications of celiac disease might be, bone density and increased risk of fractures being one of them, but also the risk of lymphoma. I think in this consultation that's probably entirely inappropriate. It's important to focus on the overwhelmingly likely outcome, which is that he'll respond to gluten exclusion and that he'll need some tests to confirm that he's responded, but on the whole that's what happens to most people. If then in the future you could defend the reasons for not going into failure of therapy or long-term complications because he's already anxious and also a little bit angry about the delay in diagnosis, and that would exacerbate things further. If he doesn't respond to therapy in the future, then you could bring up what might need to be done then.